So in this video I would like to show you the different types of extraction forceps, and so that you're able to choose them and to select the correct ones when you're working in the surgery. So first of all, you have to be able to tell the difference between upper forceps and lower forceps. And here we have an example of an upper forceps, and you can compare this to a lower forceps. So you will see that the lower forceps, the beaks of the forceps, so this part of the forceps is called the beaks are at right angles to the handle. If you compare this to the upper one, this is not the case. So here at the top we have the different types of forceps, and the forceps depend on the type of tooth that is being taken out. So first of all, we have this forceps, and this is called an upper straight or incisor forceps, and it's called straight because when you look at it, you will see that the forceps is completely straight. If you compare it to this one, you will see that there is a curve in the handle, and also the beaks of the forceps are slightly at an angle. So this forceps, which is the straight forceps, is used to extract upper incisors and canines, so the anterior teeth. The next forceps would be the upper premolar forceps, and it's used for both right and left upper premolars. If you look on the inside of the beaks, so this area of the beaks, you will see that they're completely similar, so there is no difference between the two beaks. The reason I say this is because when we go on to the next forceps, which are the upper molar forceps, there is a difference because one is used for extracting the upper right molars, and the other one is used for extracting the upper left molars. So how do you tell the difference between the two? So when you pick up the forceps, you have to hold it in your hand like this. So the curved part of the forceps is lying in the palm of your hand. And then you're going to look at the inside of the beaks, because in this forceps, unlike the premolar forceps, there is a difference between the two beaks, and you will see that on one of the beaks there is a little metal ridge, and this metal ridge has to fit on the buccal surface of the tooth. For example, if I wanted to extract Nikki's upper molar tooth, I have to place the forceps in the palm of my hand like this, and I have to make sure that this beak, the one with the ridge, is facing Nikki's cheek, or the buccal surface of the tooth, and the same is beak to cheek. So for example, in this forceps, the little ridge is on this beak, so it means that when I place the forceps around her tooth, this beak should be towards her cheek. So this means that this is the upper right molar forceps. So it would have to be so it's used to take out the tooth on her upper right side. Another way which might help you to figure out which is the left and which is the right forceps is if you hold it again in your hand like this. If the beak with the little ridge is on your left hand side, then it means that this is a forceps for extracting a patient's right tooth. So therefore, if we look at the other one, which is the upper left molar forceps, we will see that the little ridge is on this beak. So if I'm taking out her tooth, if I hold it like this, and if I want to take out her upper left molar tooth, if I place the forceps in her mouth like this, the beak with the ridge will be towards her cheek. So always remember, beak to cheek. Then the last forceps that we have is a upper root forceps, and the way we can tell that it's a root forceps is because the two beaks are touching each other. If you look at all the other forceps, you will see that there is a gap between the two beaks. With the root forceps, whether they are upper or lower, the beaks are always touching. So this is an upper root forceps. Then we have to move on to the lower forceps, and here we have these forceps, which are again used to extract lower roots, and again you will see that the beaks are touching. The forceps, which is used to extract lower incisors or anterior teeth and canines, look very similar to this one, except that when the instrument is closed, there will be a little gap between the two beaks. And then we have the next forceps, which is the lower molar extraction forceps, and it is used for both left and right, unlike the upper molar forceps. And if you look at it, you will see that both beaks are similar. So to summarize, only the upper molar forceps have a left and a right. Everything else can be used on both right and left sides.